I'm Ramaswamy Govindan, a professor of medicine at the Washington University School of Medicine in St. Louis. Patients often ask us this question, what are the risks for this cancer going to the brain or any other organ? In terms of going to the brain, it depends on the type of cancer. Some cancers, like small cell lung cancer, go to the brain more often than some other type of cancer, like squamous cell lung cancer. The small cell lung cancer has a tendency to spread to many sites, and brain being one of them. There is something about the biology of these tumors when they form, and they have a propensity to grow well in one place and the other place. And much like the seeds thrown on the soil, and some places are more conducive for its growth, the same way, in fact, we use the seed and soil hypothesis. Something intrinsically, uniquely, altered in a tumor cell, and something in the host environment, for example, in the brain or the liver, that favors its growth. So small cell lung cancer tends to go to the brain more often, anywhere between 60 to 80% in some instances. And in non-small cell lung cancer, the adenocarcinoma tends to go to the brain more often than the squamous cell lung cancer. Adenocarcinoma would put somewhere around 40%, squamous cell lung cancer around 20, 30%. Again, these percentages are useful for us to study groups of patients. For a given patient, this is not very helpful. I've taken care of patients with stage 4 adenocarcinoma of the lung for 10 years. Right from the beginning, they had stage 4 lung cancer, not one metastasis to the brain. And I've had patients who began with multiple sites of metastasis, brain being spared, never went to brain. I've had patients where it only was growing in the brain. So it is a little different. But the important thing is to appreciate that the medical therapy is increasingly being more effective. We are not where we want to be, but I think increasingly we're using multiple modalities, including radiation therapy, the pinpoint radiation, what is called the stereotactic radiation, and in some instances, operation to treat these metastatic sites. And so it is not a very reassuring answer that this cancer can go to the brain. People are frightened about that. But again, some cancers do more often than the others. And I think it is on a reassuring note, we do have more options today than we had even 10 years ago.